Good morning, everyone. We're going to go ahead and get started. Thank you for joining us today for the Grundy, Kankakee, Kendall, and Will County Advocacy Collaborative. Our theme this year is Advocating Together While Apart. My name is Gretchen Knowlton. I'm the Manager of Planning and Advocacy at AgeGuide. Helping me run the meeting today is Leslie Edstrom, Director of Planning, Grants, and Program Development. And behind the scenes is Katie Hauser, Manager of Outreach and Events. They'll be helping me watch the chat and looking for your questions. As you can see, this is our agenda for today, and we have an excellent lineup for you this morning. So to help us make sure that we don't miss any of it, please put yourselves on mute and put your cell phone on mute during the presentation too. If you've got a cell phone next to you, I'm going to do the same thing. Turn it off, put it on mute. Also wanted to let you know that we will be recording this event. Now, in this virtual world that we find ourselves in, if by chance you lose connection or having trouble with the audio, please just go back and re-click the link to rejoin the event, and you can always call in. We'll put that number in the chat. I want to welcome those of you who are joining us by phone today. You won't be able to participate in that chat, but we're so glad that you're here. Thank you. And now I'm going to stop sharing my screen for a minute, and I'd like to introduce all of the AgeGuide staff and board and committee members who are on the call today. So if you could go down to the bottom of your screen where you see the reaction buttons, and if you are from AgeGuide staff or board or committee members, would you please click the clapping hands icon to let us know that you are here today. AgeGuide staff and board members clapping hands so that we can see you all. There we go. I know that a few staff have joined us today. Thank you so much. If you're a service provider in the community, would you give us a thumbs up for all the hard work that you're doing? If you provide services in the community, give us the thumbs up sign. Oh, there's a bunch of you. Yes, so many of you have joined us today. Thank you so much. I know you are all so busy right now, and we appreciate the time you're taking to be with us. Now, if you are also or an older adult yourself, age 65 to 165, go ahead to the bottom of your screen and click the heart. Let us know that you are here too. This is not time to be shy about being over 65. This is the place for you. Don't be shy. Some of us are over 65. Excellent. Thank you for joining us. We're glad to have your input and your voice here as well. And if you're an elected official or from a local government, county, township, state office, or federal legislator or staffer, please give us the, let's see, you guys can do the little party hat with the confetti. Party hat with confetti from the legislative staffers. Thank you guys so much for being here. Excellent. I'd especially like to acknowledge these legislators and staff who have joined us today. From the federal level, we are expecting Congressman Bill Foster, who's from District 11, and he will be here with us today just a little bit later. He had some committee meetings going on, and he's going to jump on and join us as soon as he can. We have Emily Kaplan from Congresswoman Lauren Underwood's District 14. Welcome, Emily. And Dan Husbeck from Congresswoman Marie Newman's office in District 3. From the state legislature, we have Andrew Clausen for Senator Meg Koppel, and we have Samantha Quinones from State Senator Karina Villa's District 25. So thank you so much. We'll be hearing from these special guests during the remarks portion of the agenda later. Is there anyone else from a legislative office or staffer that I missed? Please go ahead and remind me in the chat, even if you've already put your name in there. I apologize if I have overlooked anyone. Oh, do we have Maria Manzo on the call? Thank you so much for joining us, Maria. And we will go ahead and save time at the end for them to share how they're addressing some of the aging priorities. And now it is my pleasure to introduce Marla Franczak, Chief Executive Officer of AgeGuide, Northeastern Illinois.
Great.
Marla.
Thank you. Thank you so much, Gretchen. And welcome everybody to our 2021 Advocacy Collaborative. AgeGuide Northeastern Illinois is the area agency on aging for the counties of DuPage, Grundy, Kane, Kankakee, Kendall, Lake, McHenry, and Will counties. And as of the last U.S. Census, there were over 703,000 older adults residing in our 8-county region. Next slide. But I want to be clear here that although we represent people 60 and over, we are all aging. And you know what? That's a really good thing. And here in Illinois, by 2030, 25% of us are going to be over the age of 60. And our older adults are also an increasingly diverse population of racial and ethnic minorities. And often they may be dealing with physical or sometimes mental health conditions, and that might even include the onset of dementia. But I do want to step back for a moment to kind of reflect on a year ago today. And I know many of you have been doing that really throughout this week. I'm sure we've all been kind of looking back to where we were at this time last year. And at that point, we were really addressing a lot of the same challenges we are today, but very, very differently. Our community dining sites were packed with older adults enjoying each other's company. We had vans full of older adults who were crisscrossing our counties, taking people to doctor's appointments and shopping. And our senior centers were all abuzz with spring parties, bingo, exercise classes, and so much more. And then in mid-March, all in-person programming that our older adults relied on came to an immediate halt. Our community dining sites, senior centers, all shut down, and they have still yet to reopen. So many things changed. We changed, and we will never be the same again. Social distancing worsened social isolation that our area agencies have been working so hard to address. It had heightened already existing vulnerabilities like access to food, medication, medical care, and to help our older adults stay safe and connected at home, our network had to reinvent programs and services to provide creative ways for people to connect. Soon, virtual cooking classes and exercise classes sprang up. We played parking lot bingo, and we made thousands of friendly phone calls to engage our older adults while they were safely at home. To address technology challenges for older adults, we started teaching them how to use Zoom, Facebook, email. We offered internet-enabled devices through a partnership with T-Mobile to those without access to Wi-Fi. And this was vital not only for them to connect with their family and friends, but their physicians were also starting to use telehealth for their office visits. And interesting, according to a recent research study that quantified the digital isolation crisis among older adults, of the over 80% of older adults who died of COVID in the US, it was estimated that about 40% of them were unable to access needed online resources because they lacked in-home internet. Let's think about that for a moment. And this was even more striking in our Black and Latino seniors, who are more than 2.5 and 3.5 times more likely to be offline. Even prior to the pandemic, though, our older adults were experiencing food insecurity. So making sure our older adults received nutrition they needed during the pandemic was AgeGuide's top priority. Our home delivered meals program has expanded to include anyone who was 60 years of age and older. As you can see from this slide, our network of nutrition providers ramped up our meals since last March. We've seen an almost 60% increased need for these meals. From March to September, the network provided a total of 877,000 meals to almost 11,000 people. We also had to modify how we distributed meals to accommodate this new reality. Of these meals, most were still delivered directly to homes, but thousands were also picked up at designated locations. and shelf-stable meals were also provided for emergency use. And I want you to keep in mind, our network continued to increase services while navigating COVID-19 protocols with their staff and volunteers, many of whom themselves were at the high-risk age group. Federal and state support that we received for these programs during COVID was a lifeline for the Aging Network in responding to the COVID-19 pandemic. And it continued support is going to be needed for us to maintain our current increased capacity to providing meals in our region. We also saw caregiver needs increasing during COVID as more people were providing help to their older family members to keep them safe at home. And I'm sure many of you on the call today were doing the same. We expanded and adapted our caregiver support programs like counseling and support groups to help them cope with the stress and isolation of caregiving. And to further help reduce their burnout, we offered these caregivers a tailored assessment called T-Care to pinpoint their stressors and to prevent burnout. Isolation was so magnified for these family caregivers, especially those caring for loved ones with dementia. So to combat this, we offered virtual programs like our intergenerational music and memory program, our Sounds Good choir and memory cafes to help keep their loved ones engaged and less isolated. And although incredibly impactful for the caregivers and their loved ones, there is not enough resources to meet this growing demand. And we know that our programs and services will not return to what they looked like last March. But you know what? That's okay. This experience has allowed us to reinvent and expand programs that further improve the quality of life for older adults and caregivers. This pandemic ignited a spark of change that really was long overdue and showed us that we could actually do it, but we are not done yet. Our challenge now is to get our older adults vaccinated to further reduce their isolation, food insecurity, and caregiver burden so that they can safely return to their life outside of their homes. These older adults sacrificed a year of their lives to stay safe from the virus, and far too many of them died from it. So getting them vaccinated is now AgeGuide's top priority. We are coordinating efforts with our funded partners and local health departments to register our older adults, provide transportation when needed, and even deliver vaccines to them in their homes if they're unable to leave them. So today when we are talking, we are going to ask our federal elected officials to take what they learn here today and keep it going so that they recognize that we need that additional support, because not only are we serving more people, but we need to get them all vaccinated. What we need to do this is to strengthen caregiver support through increased funding for the caregiver program, like we're going to see in the American Rescue Plan. But we also need to continue funding for those essential services during COVID to address the food insecurity and social isolation, these two big crises that we were talking about earlier. So we again want our elected officials to continue to prioritize and support the Aging Network in the vaccine rollout and outreach. At the state level, we also are going to need additional support for our long-term care facilities. During COVID-19, almost 50% of the deaths occurred in long-term care facilities. These residents and staff need to be protected from the virus with PPE when needed, improved infectious disease control, and more frequent testing and reporting. And with limited visitation, resources to provide technology for family visits is also going to be vital. So we ask that funding be appropriated for the Illinois Family Caregiver Act. Representative Willis introduced House Bill 293, and Senator Belt introduced Senate Bill 1766 to fund the Illinois Family Caregiver Act. This was legislation that was passed in 2004, but it has never been funded. And lastly, I just want to close with again reminding our elected officials to continue to prioritize and support the Aging Network in the vaccine rollout and all of our outreach efforts. Thank you.
Gretchen, we can't hear you.
Thank you. Just noticed that little light.
Just testing you.
That's right. I said, thank you, Marla. I said all these great things about you, but I will just move forward. If you have any questions for any of the speakers, you are welcome to put them in the chat and we can circle back to them at the end. Are there any questions for Marla at this point? Don't see anything. Our keynote speaker today is Rayanne Van Gundy, Executive Director of the Kendall County Health Department. Ms. Van Gundy has been at the Health Department for the past 19 years. Prior to being the Executive Director, she served as the Operations Administrator, where she acted as the Financial Officer, Public Information Officer, and monitored legislation. The mission of the Kendall County Health Department is to promote physical health, mental health, environmental health, protect the community's health, prevent disease, and promote family economic self-sufficiency through both person-based services and population-based programs. Welcome, Rayanne Van Gundy. Thank you for being with us here today.
Thank you so much. And thank you, Marla, for those nice comments, as well as the invite today from you and Leslie. We're very excited to talk about what's happening here in Kendall County. A little bit about Kendall County, for those of you that aren't familiar with Kendall County, we are a county of about approximately 128,000 residents. Not a lot, but we're still good size. We are still part of the Chicago metropolitan area. I'm going to talk today about our vaccine rollout and what we're doing to ensure that those seniors are getting vaccinated in an efficient and timely manner. So our rollout began back in the week between Christmas and New Year's. We received our first doses. There were about 200 doses that we took out. We were working with phase 1A at that time. And of course, we don't have a hospital here in Kendall County. So we were directly going right to our clinics, those clinics that were unaffiliated with a hospital, to our dentists, to our hygienists. We worked to get the EMS and all of our first responders vaccinated right away. That didn't take us very long because we are a smaller community and we don't have the hospital here like the other larger communities do. So that allowed us to move swiftly right into serving those first 1B priority groups. And we're proud to say that Kendall County made the seniors a priority in those 1B groups. It was the seniors, it was our additional first responders and our law enforcement and our educators. And really, we had senior days from the start where we would just take those that were age 65 and plus to really get those shots in the arms from the start. So how it happened and how we rolled it out is that the timing was perfect. And the city of Yorkville is in the process of building a new police department. And they had just purchased a vacant building. And so we were able to, thankfully, with the city of Yorkville as a partner, utilize that clinic and make that into our mobile clinic. So we weren't giving shots out of our own health department. We were going right into the community. We created a space in which people could, enter in one door and exit through another door. There was space for 15-minute waiting after their vaccines. And it was located right here in town, all on the first floor. Very convenient and very efficient for all residents here in Kendall County. We opened that mobile clinic in about January. And so we're about 12 weeks into our vaccine, which actually seems like a lifetime, but we're doing good and we're moving forward and we're happy with our progress. So our mobile clinic right now currently serves anywhere between 800 and 1,000 administrations of shots every single day. And we're very proud to say that only about 6 staff members from the health department are actually at those clinics daily, and the rest is all by community volunteers. Our community has stepped up in such a manner to, be the greeters, be at the registration table to help people register through their electronic system, to being hall monitors to make sure people were moving safely and swiftly through the building. And then also all of our nurses are volunteers as well. it has just been a huge community effort, and we are so proud to live in Kendall County because we are just moving through these arms and really making a difference. A little bit about how we met the needs of the seniors. So we would have special days and special, we call them events or clinics that were just set aside for those 65 and plus. And they would come through. We knew we had to kind of lengthen the hours, and we also made a little bit more time in between appointments because we knew the population we were about to serve were going to have a lot of questions and moving a little bit slower, and we were ready for that and prepared for that. Not only did we adjust our events and our appointment slots, but we also offer curbside service. So in the event that somebody was having a hard time getting in and out of a vehicle, we wanted to ensure that they could feel comfortable staying right in their vehicle, and we would have a nurse come out as well as someone in registration, register them, ask all the questions to ensure they were healthy that day to receive their vaccine. And we'd have the nurse next to them. They would administer the vaccine. And by providing it curbside, it was just an amazing accomplishment, because those seniors were just in tears when they knew that we could come to them. They were in tears. They were grateful. They were so appreciative of us taking that extra step. And we wouldn't think of doing anything different. Not only that, but also whenever you enter a mobile clinic, you might have a little ways to walk. So we also made a separate area where they can register anybody with any kind of mobility issue, whether they're in a wheelchair or a walker, that we would do the registration right at the greeting table. And then they would bypass the long line in order just to get in and get their vaccinations done right away. It cuts down on their wait time, any standing time. So I really feel like when we talk about it, our services being person-based, these services at the health or at the clinic are also person-based, just like they are at the health department. So we're very proud to be able to serve our residents that way as well. As far as the seniors who don't have any electronic devices or access to the internet, kind of like what Marla alluded to earlier, we have a call-in line that they can call into the health department. And from that call, we will take down their name and number, and we have volunteers within the community that will call them back and register them, so that when they arrive to the clinic on the day of the vaccination, their ticket is pre-printed and they're ready to go. And there's no questions about whether they qualify or anything like that, or if they had any trouble. It's all done for them. So we've had a wonderful outreach with our community volunteers just willing to register this special population. So a lot of seniors have gone on and registered themselves. It's on our website. There's first dose and there's second dose buttons. So they can go on and they can register themselves. They pick a time slot in which the appointment would work best for them based on their other appointments throughout the day. A lot of their children have helped them. A lot of their neighbors have helped them, and as well as the community members. So we feel like it's been a very good process, and we've, by the numbers that we have, we know we're doing pretty darn good getting those seniors vaccinated. We're excited. So we've had like the senior days, but we also did a mass vaccination at the Yorkville High School back at the beginning of February with the follow-up second dose at the end of February. These were Pfizer doses, and we had what we called was a senior Saturday, in which we only served seniors in that mass vaccination. We did over 2,000 vaccinations just in that one day. And then they came back and visited us 3 weeks later for that second vaccination. And our second dose return rate is wonderful. They know the importance of getting that second dose, and they all showed up. And it was amazing because the first mass vaccination clinic, it was negative 10 degrees and it was snowing, and they still showed up. And then the second time they came, it was sunshine and it was 40. And just to see the delight on their faces and the appreciation, the number of phone calls, Facebook messages, as well as cards sent in the mail about the appreciation, the efficiency of the process during those mass vaccination clinics was amazing. And so I know we truly made a difference, and I know that the community was very proud to be able to serve this population. A lot of tears were shed when they received that first vaccination, and a lot of hands were raised in excitement when they received that second vaccination. I think it was the idea of just giving them a little bit more freedom and maybe a little bit of a light at the end of this tunnel. So we're very excited to be able to do that. According to IDPH, our average doses here in Kendall County is about 972 a day is what we're putting out. We have over 38,000 vaccinated, which is about 30% of our population. As of yesterday, we have vaccinated 14,949 seniors. And according to the US Census, it tells us that we have about 10% of our population, or 13,000 seniors in our population. So if we've already vaccinated close to 15,000 out of the 13,000 the US Census says, I think we're doing pretty darn good. So we're excited to meet the needs of this population. We know we still have a lot more work to do in moving forward with the other populations that are equally important, but we stood up and just knew that the population of the seniors was going to be our priority from the start. We have made them the priority, and we're very proud of where we're at today. So any questions? That's really all I have about the vaccine rollout. It's community from all different corners of the county. People are invested, whether it's the volunteers that are working the clinics, if it's the volunteers that are bringing in food to the other volunteers, lending the space, lending tables, lending chairs. The outreach and the outpour of support has just been amazing, and we could not do it alone. This is not a health department pandemic. This is a community pandemic. Well, and it's a national and international pandemic, but we feel the support of everybody from every corner. And so I thank those that are on the call that either live and or work in Kendall County, because we could not do it without you. And of course, without the support of AgeGuide.
Thank you so much, Rayanne. Such a message of hope. So encouraging to hear how Kendall County is just knocking it out of the park, especially with all of those special provisions to make this easier for the older adults. There was just one comment from Senior Services Associates that their Kendall office has been helping.
Gretchen, I think you muted.
Yep, Gretchen, you did.
So if you go
there
back
we go.
It
wasn't coming off. Sorry about that. Thank you, Rayanne. Appreciate your encouraging words. It's so great to hear how Kendall County is just knocking it out of the park with all of those services specifically targeted to get the older adults vaccinated.
Thank you. It's taken a community, so we're very proud of everybody here. Thank you.
Yes. And I did want to mention that there's folks on the call from Grundy County and from Kankakee County and Will County as well. And you can find links to those health department registries on the AgeGuide website. If you go to our COVID vaccine resources page, you can find connections to Kendall County as well as the other counties on there if you want to get registered for the vaccines. That's a good first stop. Are there any other questions at this time? If we get some more questions, Rayanne, people may think of things as we go along. We can always circle back with you. Thank you so much.
Wonderful, thank you.
I'd like to introduce another AgeGuide partner, Courtney Hederman, who's the Associate State Director for Advocacy and Outreach at AARP Illinois, where she leads the vaccine outreach. Good morning, Courtney. Thank you for being with us.
Yeah, good morning. Thank you so much for having me, and just really always honored to be a partner with AgeGuide. Just really happy always to partner with you guys. So thank you for having me and including me. I will say I know that maybe not everybody on the phone knows that this is the third one that AgeGuide has done in the last 2 weeks, and a lot of my conversation has been about AARP efforts, which includes, obviously our membership is 50 and older, and, we're really getting, truly being an education and outreach type of resource for those older adults, and really the extraordinary partnerships that are going on around the state it's just extraordinary. And so Rayanne's, efforts in Kendall County, for example, like that, there's so many counties that are doing such great work. So, I mean, just commending, all the counties in general, because we don't have a centralized system. And so a lot of, again, my remarks have been kind of about that, but I do want to just share very quickly a little bit of a personal story. Haven't really shared this with many people, but my family is unfortunately had COVID. And we were early January when we were diagnosed, and it was by a handshake, which is such a random, like my husband saw someone, a friend he hadn't seen in a long time. They did a quick handshake and a hug kind of thing real fast. And 2 days later, my husband was symptomatic. I had 3 kids, and my youngest child, who did become positive, had very little symptoms, I'll be honest. Like 2 days of some congestion, and just never was on the couch, just did really great. And now we're 7-8 weeks in, and I'm sharing because today, the last 2 days, my daughter's been actually very sick. Just again, lots of congestion, lots of symptoms. And we're like, oh, it's a cold, it's fine. And we, I was very late coming into this call because I was at the doctor with her. And because she was COVID positive before, and they're showing around 7 weeks that those that were asymptomatic or very little symptoms, all of a sudden it becomes very, very symptomatic again. And it's very worrisome because then they're essentially admitted into the hospital and they're treating them for COVID. And I'm sharing this because, one, it makes me very nervous because I'm worried about my daughter, but it's just that COVID is nasty. And I know we all know this, but it just, even with somebody who, again, a kid who had very little symptoms, now still has to worry about COVID 8 weeks later. For older adults, as they're either maybe we're in that same situation and recovering, or that there were, again, I think, people who are long haulers, people who are just symptomatic, having so many issues and struggling. And there's so many older adults that are in that situation, and or they're unfortunately lost their life, or they have tremendous amount of chronic conditions now based on it. We have no idea what I think this will do to people in the long term. And so I just, I hope everybody, when they get a chance, they get the vaccine. And we're all working so hard to make sure older adults get it, because they are the most vulnerable. And I just commend everyone that's on this call who's doing tremendous work. Keep doing what you're doing. And I appreciate it. My family appreciates it. I know we all do on this call. I know I'm preaching to the choir in this, and that, we're all in this together. And I know that we're all going to continue to work together and help each other through this, and we're going to get through it. And I loved Rayanne's, vision of hope here. There was so much hope in what you shared, and so appreciative. We have still a lot of work to do. Older adults, and this is where I'm going to go back in my AARP hat here, older adults are not all getting connected. They're not all getting appointments. There's still a lot of challenges, and they're going to continue to remain that way. Again, we don't have a centralized system. We've been really working very hard with the governor's office. There's supposed to be a toll-free call released next week. I hope that's true. If you have a chance, we had a great teletown hall with Governor Pritzker and Dr. Ezike on Tuesday. That's on our Illinois Facebook page, AARP Illinois Facebook page. Please go to that. It's an hour long, but it was a great conversation, and he gave a lot of information along with Dr. Ezike. And we're going to continue to beat that drum at that level. And I know Congressman Foster's on right now. I can see him. So thank you for all the work that you are doing in Washington, as well as all of our elected officials. Tremendous, tremendous stuff. And we got a long way to go, but I'm very, very proud to be working on this, and looking forward to working with all of you going forward. So thank you so much.
Thank you so much, Courtney, and thank you for those personal words. It helps to remind us all how important that vaccine is. I did want to make sure that we have a chance to get to Congressman Bill Foster. He only has a little bit of time before he needs to go into another committee meeting. So Congressman Foster, if you are ready, would you please say a few words for us? We would appreciate
Am I
hearing.
audible and visible here?
You're good.
Okay, well, yeah, and I'm playing hooky from a science committee hearing on the science of climate change, which is an interesting and overdue hearing. Well, first off, for those of you who don't know me, I'm Congressman Bill Foster. I'm a scientist, a businessman, and I'm proud to represent the 11th Congressional District of Illinois, which has actually the second, third, and fourth largest cities of Illinois in the form of Aurora, Joliet, and Naperville. And I just want to thank you for inviting me here today to give you a very brief update on the COVID-19 relief legislation that we passed through Congress and was signed by the president yesterday. The American Rescue Plan, as it calls it, delivers relief that we need to stay on the offense against COVID-19 and to help struggling families and small businesses stay afloat. So much of our ability to defeat COVID-19 and get our economy back open depends on our ability to get shots in arms. Making sure that every American who wants a vaccine can get one is essential, and the Biden administration has vastly improved the planning and logistics and has gotten major new commitments from vaccine manufacturers that have us on an accelerated timescale to make sure that's happening. The American Rescue Plan builds on the progress of the last year and invests in a coordinated nationwide vaccine program with three key parts. First and foremost, to make sure that we have enough vaccines for all Americans. And this is something that I've been working on in Washington, D.C., just basically nonstop. I got appointed at the start of this crisis. I was appointed to the Coronavirus Oversight Select Committee, where one of the major things we're doing is just looking over the shoulder of what was called Operation Warp Speed. Is basically, Congress. At the very start of the pandemic, Congress voted a very large amount of money specifically for vaccines, and then and almost immediately thereafter gave specific directions that we wanted this money given to as many vaccine manufacturers as have a chance of delivering the product. And this is, we gave money to 6 vaccine manufacturers, and it looks like 3 and maybe 4 of them will actually be delivering a vaccine on time to really have an impact in the United States. And so I think that's a very good use of American money, even though some of the manufacturers didn't deliver on time. We got what we needed from those who did. And getting those, the next step, of course, is getting those vaccines out to people through community vaccination centers, mobile vaccination units, federally qualified healthcare centers, every way we can, local pharmacies where available, and more. And then finally, active communication so that people know how, when, where, and why they should be vaccinated. And this is something that I know I have been, since months ago, have been telling my staff to concentrate on getting the message out so that everyone should get vaccinated as soon as it's possible. And it's not an easy job. Just yesterday, I had a virtual meeting with some people who operate an elderly care center. They saw very good vaccine uptake, 90% among the elderly patients. They saw only 10% vaccine uptake among those who worked. And we talked for a long time about what may be necessary to try to get that number up, because that's a risk that we shouldn't be taking as a country. And it's going to be an ongoing discussion unless we can find ways to get the numbers up for vaccine acceptance in all segments of our community. This is going to be a long haul and a long pandemic for our whole country. But you can't do this without money. And the American Rescue Plan provides $20 billion just to make sure our vaccine efforts are successful, including funding to hire additional public health workers in our communities to get people vaccinated. A lot of the heroic efforts that are being stood up now in the states, they're not fully funded and they're not sustainable had we not passed this. And so I'm very proud that states like Illinois have just gone, and counties have just, dug into every source of money they can find to get the system set up to vaccinate people. And now with what the president signed yesterday, money-wise, the cavalry will be arriving. And I think that these will all be fully funded for as long as we need them to stamp out the pandemic. It includes nearly $50 billion also in improving testing and tracing. And it invests specifically in the rapid testing, including rapid at-home testing. That will be, I think, very important to fully reopening our entire economy. This is, I think, going to be increasingly important as the pandemic fades away and that we're faced with sort of persistent flare-ups and outbreaks of new coronavirus variants in various of our communities, that when we see a flare-up, we can't shut down the whole state, but we'll just mail out little at-home test kits to everyone in a community so that they can quickly get a reading on whether or not they are, they're infected and infectious. And so it's that sort of capacity. Had we had that in place at the start of the pandemic, that would have been transformative. And we want to get it in place, not only for future pandemics, but for the real possibility that we may encounter a variant that is so different than the circulating variant that it's like a whole new virus, and we just start over from zero. And so it's one of the things I'm really proud of, is that the Biden administration is thinking about what can go wrong, and not just planning for success, but they're making sure that we have contingency planning for things like new variants of virus and tools like rapid at-home testing so that we can actually fight back outbreaks without having to shut down the whole economy and all of our schools and so on. And on top of the investments in public health, it included additional economic relief for individuals and families. There's the $1,400 direct payment to individuals. There's the enhanced child tax credits. And even though this isn't, I guess, really an elderly issue, many elderly have grandchildren or great-grandchildren and families that are under financial stress. And it'll, I hope, be of some source of consolation, if not happiness, to know that there is some financial relief for families that are having a hard time doing things like paying for healthcare and paying for childcare. The American Rescue Plan also provides funding needed to keep loan programs open for small businesses, to keep their doors open. And that's fundamental. The sadness that someone feels when they see a restaurant closed that they used to love going to and wondering if it's going to come back is real. And we have both general purpose funding for businesses as a whole, and targeted funding for restaurants and shuttered venues, as they're called, which are just theaters and places like that where people at least look forward to going to when they get clear. This legislation also specifically provides funding to support programs that are helping older Americans. Includes almost $500 million to help senior care facilities keep their residents healthy and safe. The package directs $1.5 billion into the Older Americans Act programs, including senior nutrition and programs to perform vaccine education and outreach. So we really make sure that our citizens know how, when, and where to get vaccinated. And there is light at the end of the tunnel here, and I believe that together we'll get through this, and this relief package is a big part of making sure you can do that. And I'm proud to have been able to vote for it and support it, and hope it does the good that we designed it to. Thank you all
so much. Thank you so much, Congressman, for being here with us and taking time out of your busy committee schedule to be here. We really have been keeping a close eye on this rescue plan, and you're right, it does contain some really wonderful supports, especially for older adults, and the caregiver supports, the congregate and home delivered nutrition services supports. All of those things are really valuable to us. We did have
the state and local money will be a very great indirect, just
right.
Reducing the amount of fiscal stress on government at all levels is going to make them more able to offer special assistance for the specialized needs that they see in their communities. So you won't see that directly as a line item, but it's going to make them
right.
more receptive when you go and ask for some special thing that's really needed for the elderly.
That's a very good point. Yes, thank you. Thank you for sharing that. We have a lot of thank yous in the comments. Everybody's so happy that you could be here with us today. Yep. We appreciate it.
Okay, I'm afraid I have to jump off. I think my questioning there's an order of questioning, and I think I may come up fairly quickly, so I have to jump.
All right, we'll let you go. Thank you for joining us.
And thank you all for everything you do. It's really important.
Thank you. Bye-bye. We will circle back to some more legislative updates in a few minutes, but I want to introduce our next speaker on the agenda, who is Lauren Doherty, the Chief Executive Officer at Meals on Wheels Foundation of Northern Illinois, as well as the Community Nutrition Network and Senior Services Associates. Lauren has experience working in the health, wellness, and fitness industry and is dedicated to ensuring that older adults are healthy and age well. She's going to share her view from the front lines. Welcome, Lauren Doherty.
Good morning. It's nice to be here with you all today. Thanks to everyone who's already spoken, and of course to Marla and everyone at AgeGuide for giving us the opportunity to tell our story. And right now, reflecting on this time last year, we were actually with Jenny Moore, who is with AgeGuide, and our Director of Operations, Spencer, looking at new sites in Will County. Little did we know that everything would be shutting down by the end of that week. So things have been crazy for us as with everyone else. So we are a nutrition provider, Community Nutrition Network and Senior Services Association. We provide meals in Cook, Kendall, Grundy, and Will County. This call is specifically in regards to Will, Kendall, and Grundy, but I have to highlight our whole organization for a second. So we provided, 830,000 meals in FY20. So, and that was to 7,300 clients. So to put that into perspective with the COVID impact, in FY19, we served about 630,000 meals to 5,300 clients. So that's roughly 200,000 more meals and 2,000 more clients that we're serving on a daily basis. So the impact for us has been massive across the board. I'll start with Kendall and Grundy because those two counties, I don't want to say they were the easiest for us, but they certainly have a lot of resources. That's what our nutrition directors there like to say. So in Kendall County, we actually did not see a mad rush for clients who needed meal services, which really is just kudos to that county. Those seniors are well cared for. So what we were able to do is provide socialization opportunities. Our nutrition director out there, Luis Meritato, organized her own volunteer calling program to help with our seniors who were isolated, of course, because they're quarantined at the time. So they wanted to call them and check in on them. They had numerous organizations donate things like hand sanitizer and masks, and they were able to put together goodie bags for the seniors. And the calls that they received they were so incredibly grateful. And then of course they're expressing concern for our volunteer drivers who are delivering meals to them every day. It's been wonderful. For Grundy County, that's another county where there are a lot of food insecurity resources as well. So anyone who's from Grundy County, kudos to you guys. We did see about a 33% increase in providing meals in Grundy County, which was not terrible, but certainly quite a bit when it's unexpected. We have a wonderful core group of volunteers in Grundy County who were able to take on that increased number of deliveries Monday through Friday. And the same thing was accomplished there. We're sending out puzzles, we're making phone calls, we're doing everything that we can to help our seniors feel less isolated. And they, of course, love that. They're always ready and willing to talk. Now that our outlier is actually Will County. So we are new to Will County. We actually started providing services there April 1st. So if you do the math real quick, it's probably a wonderful time to take on providing services to a new county. When we started providing services in Will County, all of those clients were currently receiving boxes of frozen meals once a week. As an organization, we decided that it was very important to continue delivering hot meals to our clients Monday through Friday. So we brought back all of our staff in that county, we brought back all of the volunteers and we reinstated Monday through Friday hot meal deliveries, which was of course very important to us just in limiting the social isolation aspect, but of course checking on the well-being of our clients, especially during a time like this. In Will County, we actually started with about, my cat just jumped in my lap. I'm so sorry. We started with about 350 clients in Will County in total. That was April 1st, and we ended with over 900 in September. The growth in that area was, I've never seen anything like it personally. It was massive, but thankfully we were able to provide meals to all of those clients and get those meals delivered every day, thanks to the additional COVID acts, the funding there, and of course the assistance from AgeGuide. So we've received tons of calls, tons of letters, tons of notes from clients who are just absolutely ecstatic that we were still able to provide meals to everyone. And they're so grateful for not having to go to the grocery store, or just not having to worry quite as much as they did before. So.
Wonderful. Thank you so much for giving us that close-up view of what's been going on with the nutrition services. I know you guys have been working so hard, Lauren, and we really appreciate you being there. Excellent. And now we're going to hear from some of our other state and federal legislators, mostly representatives of those legislators, their staffers. But before that, we do that, I just wanted to reiterate AgeGuide's policy priorities, which Marla shared at the beginning, but I know some people jumped on a little bit later. And I just wanted to remind everybody that we're really focusing on caregivers, on COVID vaccine access for older adults, long-term care support, and funding for Older Americans Act services, like those that were funded in their most recent COVID relief bill. So we're very happy about that. Now, remember, if you have any questions for the legislators or staffers, please put them in the chat and we'll read them off as time allows. I would like to start with Emily Kaplan. Are you still here with us, Emily? I know you had a hard stop at 11. Hi, welcome from U.S. Congresswoman Lauren Underwood's office. Go ahead, Emily. Thank you.
Sure. Thank you for having me. I've been taking notes throughout. So I'm Emily Kaplan. As shared, I'm a constituent services representative in Congresswoman Underwood's office. We're the 14th Congressional District in Illinois. And the Congresswoman wishes she could be here. She is currently on her way to Grace's Place. It's a childcare provider in Plano. She's speaking with educators and families in a few minutes. So she was unable to attend today. The House, as you know, had a very busy week. Most notably on Wednesday, they passed the American Rescue Plan. Quite simply, the plan puts money in pockets, shots in arms, children in schools, people in jobs. It delivers another round of economic impact payments. It extends unemployment. It includes a national vaccination plan that includes setting up community vaccination sites nationwide and scaling up testing, tracing, addressing shortages of personal protective equipment and other critical supplies. The bill also included two of Congresswoman Underwood's bills. So it included the Congresswoman's Health Force, Resilience Force, and Jobs to Fight COVID Act, which would invest billions in public health infrastructure to recruit, train, employ hundreds of thousands of Americans to build public health capacity, and the Healthcare Affordability Act, which would make healthcare premiums more affordable and lower out-of-pocket costs by making tax credits for the health insurance marketplace plans more generous and available to more Americans. The legislation also includes $1.4 billion in additional funding to support the critical Older Americans Act programs like meal delivery, caregiver support, ombudsman programs, vaccine outreach and coordination. And I wanted to share just briefly a little bit about my role in the office. I work with constituents every day who are experiencing issues with federal programs like Medicare, the IRS, the VA, really any federal program you can think of. And we have helped recover over $12 million in benefits for constituents. And so if you or anyone who you work with is experiencing an issue with a federal agency, please reach out to our office because we are there to assist. And I also wanted to share that the Medicare general enrollment period is happening now through the end of March. And so the Congresswoman has hosted a Facebook Live event where she spoke with a representative from Medicare about Medicare general enrollment. And there is a really helpful Q&A video that can be found on the Congresswoman's Facebook page. And so feel free to reach out to us if you're having trouble finding that video or looking for additional resources, because we have quite a large library of video resources and Q&As that she's hosted. And of course, please don't hesitate to reach out to the office and refer clients or community members to us as well.
Thank you so much, Emily. Appreciate that update. I'm not seeing any questions yet, but we can always circle back to those. Next, I would like to introduce Dan Husbeck from U.S. Congresswoman Maureen Newman's office. Dan, do you want to unmute yourself?
Sure. Hi, everyone. My name is Dan Husbeck. I'm the lead constituent liaison for Congresswoman Newman. Unfortunately, the Congresswoman cannot be here today. She's actually flying back from Washington as we speak. But I did want to highlight some of the some parts of the American Rescue Plan as it relates to older Americans. So again, as you know, it was signed into law yesterday, and some really important aspects of that legislation. $1.4 billion in funding for programs authorized under the Older Americans Act. So that includes support for programs, nutrition programs, community-based support programs, and the National Family Caregiver Support Program. There is $37 million for USDA's Commodity Supplemental Food Program, which provides direct food assistance to low-income seniors. And in addition to the general $1,400 stimulus checks, there is also a provision allowing for older dependents who are claimed on their family members' taxes to receive a stimulus check this time. And then also, I just want to highlight our district office, what we can do, the services that we can provide. And just for reference, our district, as it relates to Will County, covers Homer Glen, Lockport, and then also portions of Romeoville, Crest Hill, and Joliet. So part of my job is to assist seniors navigating federal agencies. So issues with Social Security, Medicare. At this point, we're also trying to help people track down vaccine appointments. So even if it's not something that's necessarily related to a federal agency, if you call our office, we will do our absolute best to point you in the right direction. And I'm happy to put in my contact info in the chat as well.
That would be great. Thank you, Dan. We appreciate all those constituent services that you provide. And we look forward to continuing to partner with you and Congresswoman Newman's office. Thank you very much.
Thank you.
Next, we have Andrew Clausen for Illinois Senator Meg Koppel. Did I say that correctly? Oh, you're on mute.
Yes, Koppel, you got that right. Perfect.
All right, great. Thank you.
Yeah, so I'm her legislative assistant. She wishes she could be here, but she is in another meeting right now. I've taken notes I will pass along to her. This is an issue that is close to her heart. Her father is an older adult, and he recently moved in with her and her family. And she has become his primary caregiver over the last year, taking care of errands, filling up medications, and driving to doctor's appointments, as well as just general care for him as well. So she does understand and has compassion for caregivers and what older adults have gone through during the pandemic. She has supported vaccines being directed to long-term care facilities, being the first ones to get it since they are the highest risk individuals. Whether it was older adults or just immune compromised people, she supported that. She also understood that PPE and testing are necessary to control the spread of COVID when vaccines are not available. So providing that and making sure there's a steady flow of PPE getting to those nursing homes is very important. Currently right now in this session, she has a Senate resolution about the Silver Search program, which would ask local authorities and counties to utilize the Silver Search program. And for those who don't know, Silver Search is for adults who suffer from Alzheimer's or dementia. They may become disoriented and may get lost or wander off. And this sends out notifications via text, phone, radio, TV, and also on those big billboards on the side of the highway through the Department of Transportation, making people aware to look for these at-risk individuals who are lost. The Silver Search program has been activated 121 times since it has been created, and it has exceeded 120 of those times. So it is a very successful program, and she hopes other people will continue to use it to make sure that these older adults are safe and can remain healthy. And also to touch on our constituent services, you can reach our office for any state-related issues like IDES troubles, all that sort of stuff. We can help with that at the state level. And if it is a federal issue, we'll pass it along to the federal constituent services as well. So feel free to reach out to us.
Wonderful. Thank you, Andrew. And feel free to put your contact information in the chat as well. Appreciate your partnership. And next we have Samantha Quinones from State Senator Karina Villa's office. Samantha? Did we lose Samantha? Or is she muted? I saw her earlier.
Gretchen, I no longer see her in the
okay, she maybe got booted off. All right. We did have Representative Senator Karina Villa's office with us at some point, so they are a good supporter of ours and a good partner as well. But that concludes our portion on advocacy. I want to go ahead and share some contact information for AgeGuide in case you want to get in touch with us or get more connected to us. Let me just screen up for a second. Pardon me. Thank you. You can subscribe to our newsletter, which is called the Aging Report. You can always follow us on Facebook and Twitter. If you haven't already, I would recommend that you pull out your phone right now and go ahead and like us on Facebook, follow us on Twitter, visit our website. We've got all kinds of resources on there, especially right now. We've got a lot of vaccine information for the various counties. We've got all the registries up there. We've got the pharmacy contact information up there. So get in touch with us if there's anything we can help you with. We've got resources. We can refer you to the local funded partners who provide the services in your counties. I just want to thank all of you so much for your time and for joining us today. This concludes our Advocacy Collaborative. Have a great day. I'm going to stop the recording.